Coming up on this month's episode of the CANdid Connection, little change. We're actually live and on tape. So thanks for joining us here in the CANdid Connection studios. We're going to be talking about some state issues. We finally got committees in the House, and members have been selected to sit on those committees. So we'll talk about that a little bit. Ashley's going to share some information on what's happening in grassroots here in Michigan and how we've got some great activities for volunteers out there. And this month we've got Keysha Brooks-Coley, who is the Vice President for Federal Advocacy and Strategic Alliances at ACS CAN, joining us. So all that and more next on The Connection. Welcome, everyone, to the CANdid Connection. This is Andrew Sheppers, your Government Relations Director here at ACS CAN, and joining me...
Hey, everybody, it's Ashley Wakefield, the Grassroots Manager here in Michigan.
Well, Ashley, thanks for joining us again. It's February.
It's February.
We made it.
We're marching on.
That's right. The legislature has started here in Michigan, and so, we're excited to see that that things may start to get to work here.
Yes, it looks like they're going to be pretty busy.
Yep. So, why don't we get right into the state updates, and we'll talk about some of the things that have been happening. You know, the legislature came in and they're required, the third Wednesday of the month?
Yep.
To come in and just kind of get themselves settled, and they did. And with that, the process started in terms of finalizing committee chairs and whatnot. And so we have committee chairs now, and it sounds like Representative Brooks-Coley is going to be chairing the Health Policy Committee.
Yeah.
Which she was on the committee before last term. So it's great to see that, we got somebody with some knowledge in terms of understanding that. And so, and I've had the opportunity to meet with her several times, talk about health policy issues, and she always really seems to be on point in terms of being connected with patients.
Good. Yeah, I think our volunteers are looking forward to, building that relationship and working with her, hopefully.
Yeah, so I'm really hoping for that too. And I know she's been to a couple of our Cancer Caucus events in past terms. So it's nice to kind of see hopefully a friendly face coming up in committee. But, another big committee we deal with in the House is insurance, and especially this term, how we're really focused on insurance issues, oral chemotherapy or oral anti-cancer medication fairness is, our main topic this year. And so, it's nice to see that, Dare Rendon, who was chair of that committee last term, is now will be chair again. Mm-hmm. and she's the sponsor of our bill.
Right. We couldn't have asked maybe for a better situation and kind of set us up for success, ideally, with oral anti-cancer fairness. I know that it's not a new issue here in the state.
Oh my gosh, it's been going on forever. I think it's 15 years now.
The benefit of that is we're well educated on it. The downside is that we're still working on it. We really have to get to it. And I know that, even though it's been so long, the motivation to get it over the finish line is still just as strong.
Yeah, no, I agree. I think that the passion is definitely there for all the volunteers that have been working on this issue for so long. And so, and we've had some positive conversations so far, haven't we?
We have. We certainly have. It seems that leadership understands the importance of this, especially now. I mean, they know what we've always known.
Yes.
Is kind of the sense that I'm getting.
Yep. I feel the same way too. And I think, unfortunately, COVID has really kind of painted the way that we look at things now. And so I think that it's it's great to see that that folks here, at least in Michigan, are really hopefully will take oral anti-cancer medication fairness for real this time.
Yeah, certainly. I don't see how they couldn't.
I know. I know.
But,
Yep. So, but, with that, I think it'll be interesting to see, we've got the governor who'll be giving her budget message here in the middle of February.
Yep.
And so, it'll be interesting to see what her priorities are. I know one of our priorities, which is, one would think pretty basic,
right,
when you look at the budget we're talking about. Our Health and Human Services budget, if I remember right, is about $25 billion here in Michigan, and we're asking for just $60,000 to keep our quit line open for a full 12 months. I mean, I would hope that I would hope that this could be something that folks in the legislature would be interested and help us out.
Now, can you back up just a quick second to explain why we're having to ask for just a smidge more? Isn't there an issue with the quit line right now?
Yeah, it's a great question. And so our quit line is all federally funded here in Michigan.
Okay.
And so no state dollars go into that program, but with things happening at the CDC and priorities changing and whatnot, that, Michigan has seen, their grant that covers that program shrink a little bit.
Okay.
And so because of that, when grants shrink, it means it's less money.
Yeah.
And so then they find themselves in a situation where, August and September, the last 2 months of the fiscal year,
okay,
it's not a calendar year, it's a fiscal year.
Got it.
Okay. So it's not even around Christmas, which people would think, right? Thanksgiving, Christmas. No, it's really end of summer, start of fall, where the Department of Health and Human Services here in Michigan has to scramble around to find money to cover those 2 months.
Got it.
And so what we're saying is stop scrambling, right?
Sure.
I know when you look at our Medicaid population, over 20% of our Medicaid population uses a tobacco product. This quit line is here to help them. And so, we need to ensure that there's funding that when they call, somebody picks up the phone. And so our big push for that is coming up. We've talked to the governor's office about including that in her budget. We've made that request a couple times, and now we're working with House and Senate members that when the budget gets to them and it's their turn, that they go ahead and throw some of that money in there for us too. So, so it's a wait and see in terms of what's happening there. But we've also been busy doing some other activities with volunteers, haven't we, Ashley?
Yes, it's a new year and lots of exciting things happening. So a couple of things, just a little shout out to our Advocacy Academy participants. I talked about this last month on the podcast, but it's a group of high schoolers and some college kids who decided to join us that are, really interested in becoming health advocates and wanting to learn kind of every facet of what that looks like and what advocacy looks like. And so we just had a really great first meeting. They are energized. Cool. I will say that they gave me a shot of energy, and excitement. So I'm really proud of them. I think it's going to be a really good program moving forward. But one thing that I'm super excited about is registration for our Cancer Action Week is officially open.
Yes, hooray!
Believe it or not, it is another year gone, and we're planning for the next one. It's going to be the last week in April, so April 26th through the 30th.
Okay.
So there's going to be some really great things happening that week of meeting with our lawmakers and bringing, like you mentioned, oral anti-cancer fairness to the forefront and having a discussion around that and probably some other things. So we're really excited. And then the last thing that we have going on in February is our volunteer training.
Oh, volunteer training. Yes. Got it.
So in volunteer training, it's going to be February 20th. It's going to be all virtual.
Okay.
But the thing I want to just kind of put out there is you can join even if you haven't been a volunteer before. Okay. This is a really great spot to start. It'll give you, an idea of what we do and how to get involved. And so if that interests you, head on over to fightcancer.org/MI.
Got it. Yeah. So again, if you're looking for more information, head to our website at fightcancer.org/MI to get information about all of our grassroots activities, along with issues we're working on. We've got a lot of that up there, and we'll have action alerts when we need some help. So again, head to fightcancer.org/MI for more information. Well, now we're excited to get into the part of our show where our guest will be joining us, and we're pretty excited because we had a pretty good lame duck session federally in terms of some of our issues. And so joining us today is Keysha Brooks-Coley. She's our Vice President for Federal Advocacy and Strategic Alliances. That's pretty long.
Yes.
But it sounds very encompassing in terms of all the great work that she does. So she's the head federal lobbyist for ACS CAN and leads our federal relations team in D.C. So she leads all our advocacy, strategic alliance efforts to implement strategies and build relationships with patient and provider coalitions all around the country. And also, she serves as the executive director for the Patient Quality of Life Coalition. I didn't even know that this existed on a federal level, but it's a coalition that we created in 2013.
Oh, wow.
So definitely pre-me.
Yeah.
But really focusing on the interests of patients and families dealing with serious illness. So definitely a great cause. But before that, Keysha worked in the Senate and was a staff member for the U.S. Senate HEAL Committee. So everyone's like, what's HEAL? HEAL or HELP Committee, It's Health, Education, Labor, and Pensions, all kind of put together. And she served on helped with the subcommittee dealing with retirement, security, and aging. So really focusing on health policy for those in the aging community, but focusing also on women's health, public health, biomedical research, health disparities, and health and human services appropriations.
What a wealth of knowledge. We're so lucky to have her, aren't we?
I know, we are. We are. So, Keysha got her bachelor's in sociology and political science from Towson University. And she got her master's degree in political management from George Washington University. So, Keysha, we appreciate you taking some time to join us today.
Thank you, Andrew and Ashley, and thanks for the really warm welcome. Appreciate it and excited to be here with you both this afternoon.
Yeah, so it's, man, what a great fall for cancer patients, especially on a federal level. And kudos to you and your team in terms of bringing home some big wins for us.
Yes, thank you, Andrew, and have to say that we rounded out the 2020 calendar year, which has been, as we know, it was a challenging year, but we were able to really have some unbelievable successful wins at the end of the year that I'm still in a place where I'm still smiling about with our clinical trials, our Enhancing Research Act that passed, our Henrietta Lacks legislation, as well as the colorectal legislation that we have been working on for over 10 years for a lot of people who have been working with us and volunteering with us for many years. So looking forward to an exciting 2021 and still, like I said, smiling about a lot of the great things that happened for cancer patients at the end of 2020.
Yeah. Well, and kind of building off that, now we have a new administration, and we know that the president, really took the reins of the cancer moonshot. So he's been affected by this, and really, shares his story with everyone. Mm-hmm. What do you think this new administration coming in and a new term coming over in Congress, will that help our momentum moving forward, or how does that really kind of affect how we're going to play in some of our issues we'll be bringing up?
Sure. So I think that we're poised to be able to work with a president and a White House and new administration who understands cancer and a president who has his own cancer story. And for our organization, we know how important that story is, and for people who have been touched by cancer, how they lead and do their daily work with that in their mind. And so I think that is something that's exciting and something that we've never been able to participate in. And we know that President Biden led on the moonshot, which was, really doubling down with support for increased funding for cancer research. We know that he looked at all issues of cancer patients, especially because of the experience that he had with his son passing away from the disease. And we've heard him talk about, cancer issues and policy changes that are needed. And I think we're in a position where we're hopeful to be able to see how having a president in the White House who has that story leads to opportunities to engage on the important work that we do and the broader community does. I think it's going to take a little bit of time. We have to keep in mind that COVID is top of mind for this administration, for the 117th Congress. We have to figure out how this public health crisis turns into one that we can see in the rearview mirror. We have a long way to go. And I think that we have to keep that in mind, that we're going to have to be a little patient. It's not like we're in a situation where President Biden can come in and lead specifically looking at cancer and talking about it immediately. We're going to work to figure out how do we have conversations with staff and people who are close to him, but also keeping in the mind too that we have to look at a lot of our priorities through the COVID lens and the health equity lens, which I can talk to in a little bit, in a little bit more detail as well.
Yeah, no, it's and you kind of segue us into a great point in terms of talking about now that we have this new Congress and new administration and we know that COVID will be a big focus. One, kind of what will our issues be for the term in terms of what we want to work on, and two, you mentioned a little bit about COVID and how it's kind of affecting how things are, how things are moving. How has COVID really affected the cancer lens in terms of how we think of strategy in terms of moving those issues forward?
Sure. So I think if you look at last year and the work that we did at the federal level, a lot of that work was through the COVID packages and the stimulus packages. And we were fighting and advocating for things, including our volunteers as well, asking for things like an ability for a special enrollment period, because we knew how important access to healthcare was. We've always known, but in the middle of a pandemic, even more important, we weren't able to get the bipartisan support that was needed in to be able to allow for a special enrollment period to move forward. We saw President Biden do that last week in an executive order, which was great to be able to see. We know how important it is to have access to affordable quality health care. Now people will be able to do that. And so policy changes like that are extremely important. I think also looking at the importance of screening, for example, in the American Cancer Society, of course, the enterprise-wide, we're looking at a new project, Return to Screening, that we're doing in partnership with other organizations like the National Comprehensive Cancer Network. And on the advocacy side, we will be advocating for more funding for that important life-saving screening. We know from the National Cancer Institute, thousands of people are not getting their screening that's needed. And we know that's going to lead to cancers being diagnosed at later stages. And we know that leads to poorer outcomes. So we will be advocating for funding for important programs like the National Breast and Cancer Early Detection Program, for more funding for making sure that women can have access to life-saving screenings, the colorectal program as well. And so that's kind of the lens that we're going to have to use, that's just a little bit different than we have in the past, because that COVID lens is top of mind for legislators and for this administration. And we're going to have to position ourselves to make sure that we are asking and advocating for things in that lens.
Yeah, No, it makes a ton of sense. And, I think for us, when we talk about that COVID lens and really access to care, we're one of 7 states that doesn't provide protections for oral anti-cancer medications. And so, again, our volunteers have stepped up and said that this is the number one issue that they want to work on. And we know that here in Michigan, the reach the policy can have can only go so far, and that there would have to be some work on the federal level as well. And we know that bills in past terms have been introduced, and we looking through that COVID lens and ensuring access. Do you feel that there's a way that oral anti-cancer fairness could be addressed on the federal level this year?
So, sure. I think that that's legislation that we've worked on for many years across the country. A lot of great state work that's been done to make sure that, policies that can be impacted on the state level can be impacted through policy changes on the federal level. So those plans, those ERISA plans that only can be addressed on the federal level, we've been very supportive of that federal legislation. We worked with the cancer community to try to see if we could get it included in the stimulus packages last year. We'll continue to work with the cancer community to see if we're able to move those policy changes forward this year as well. And I think, looking at again, through the COVID lens, it makes a lot of sense because it's access to those medications that don't require patients to have to go to a hospital for their chemotherapy example, but access to oral oncolytics that people can take in their home. So we will be tracking that legislation as it's reintroduced and supportive of it moving forward.
Great. Well, I think that we're all excited about it here, and I think we're definitely hopeful that on a federal level something could happen. So, so thank you for that. Is there any big surprise that you think may pop up here in Congress over the next couple years or this term that that may end up becoming a priority that you don't think may be a priority today for those fighting cancer?
Well, I think when you think of a surprise, I'd have to go to our access to care bucket, right?
Yeah.
I call that our biggest bucket of issues that we work on ACS CAN, probably on the federal and state level together. It's a little, when I think of little surprise, it's thinking of, what are some things that maybe we don't know about that might impact our work.
Yeah.
We have the Texas or California versus US case that the Supreme Court heard around the constitutionality of the Affordable Care Act that we're waiting to hear what their decision is. I think we all walked away from oral arguments and felt like, wow, like maybe we're going to be okay and the law is going to be found constitutional. However, we're not going to know for sure until the Supreme Court comes down with their ruling. That ruling and the implications of that ruling are going to be extremely impactful on the work that we do on access to care issues. If it's found to be unconstitutional, wow. Lots of surprises there and lots of conversations about how the current administration and Congress would respond to that. If the law is found to be constitutional, I think a lot of us in the health policy space are ready to have those conversations around how do we strengthen the law? How do we address subsidies and making sure that those individuals who don't have ability to get subsidies and support for buying on the exchanges, how do we, address other policy issues that, really just would strengthen the law? We haven't been able to have those conversations. Unfortunately, it's been a lot of what I call whack-a-mole in trying to make sure that bad things don't happen and make sure that cancer patients continue to have access to the care that they need and aren't, in a position where they might be sold a short-term limited duration plan or other plans that aren't as supportive. So I think that those are always potential surprises in my mind, and things that kind of keep me up at night when I'm thinking about what we have to kind of be proactively thinking about.
Well, definitely fingers crossed, knock on wood over here, because I know that that would definitely affect a big population here in Michigan.
Mhm.
So so we'll keep our fingers crossed. I know our volunteers will be up and ready to go whenever you need us. So well, finally, as you know, February is Valentine's Day month, and I know that we always try to throw out a funny question at the end to just kind of humanize things a little bit, but I'm a huge chocolate fan.
Oh,
Love it. Any chocolates I can get.
Me too.
Yeah, count me in,
Yeah.
and I don't
Free.
care what's in the middle of it. I'll still eat it. Like, it's delicious. So, um, what is your favorite chocolate candy if you're a fan of chocolate at all, or what's your favorite Valentine's Day candy, Keysha?
Well, I have to say that I like all my gifts I get, I receive on Valentine's Day. I have 4 kids and a husband who usually does very well with showing mom and wife, how much she is loved. I do have to say, though, I'm a little bit of a chocolate, snob.
Okay, all right,
Okay,
nice,
okay.
nice.
I'm just going to be honest and put it out there. You asked. I'm a big fan of Godiva. It's a
Okay.
little bit of a splurge, but I love my hazelnut Godiva chocolates. So you asked.
All right.
Good choice.
Well,
Good
now we
Now
know.
we know. Yes.
You may
I
end up
figured
with
I would keep it honest.
box and box of hazelnut chocolates heading your way now from Godiva.
Oh, wow.
Yeah.
Oh, best friends forever, Andrew.
Yeah, that's right. That's right. Oh gosh. Well, Keysha, thank you so much for
Thank
taking a few minutes out of your day today to join us and filling us in on what ACS Can will be working on here in the next term. And again, we just appreciate you taking the time.
Of course. And thank you to both you and to Ashley. And thanks for all of the work that you all do in your state and across the country. Whenever we need that grassroots engagement and hitting the hill and hitting our contacts to make sure that they know how important the issues are that we work on, you all are right there and ready to go. And I appreciate that ability to have that partnership at all times. So thanks for having me.
Absolutely.
Yeah, no, we appreciate it. Again, Keysha Brooks-Coley, the Vice President for Federal Advocacy and Strategic Alliance at ACS Can. Thanks again for joining us. We appreciate it.
Thanks. Take care. Bye.
Right. Well,
Lots of good things.
Lots of good things on the horizon, man.
Yeah.
That's pretty exciting stuff.
It is. You know what I'm most excited about, and I'm biased because of where I get to work hand in hand with the volunteers, but I think they're going to be really excited about this and engaged and ready to get to work. She talked a lot about the screenings and things like that. I know that we have some volunteers within our ranks that are here today because of those programs.
Oh, definitely. Yeah.
And so that excites me, and I hope for our listeners that they are able to, hold on one more year through this craziness of virtual and pivoting.
I know, virtual and pivoting. Well, to our listeners and our viewers today.
Yes,
so, we're excited to do something new and try to find a new way to kind of reach out to folks that are interested in cancer issues here in Michigan. And so, this is, I don't know, we've been talking about this for a little bit, but
here it is.
Here we are.
Yeah. So if you're listening to this on the normal podcast channon, right?
Yes.
And I usually direct you to there, and you're like, what are they talking about? I can't see them. Head on over to our Facebook page, and you're going to see the live broadcast of this on like today. So, make sure to watch it live, follow us there. And then if you haven't followed us on our other social media channels, I'm just going to put a little plug in there. We're on Instagram, where we give you a little bit more of the behind the scenes, what's happening, and then on our Twitter. So please follow,
So go ahead and check those channels out. And again, head to our website. Our website has a ton of great information. Again, that's fightcancer.org/MI. So go ahead and join us there and see if there's great information there too. So, but that wraps up our show today. We're very excited that you were able to join us. again, as you can see, those that are watching on video, we also have now another member of our team who is producing our video today, my son Aiden Roberts. And so thanks for being here and helping us out. Yeah, we're excited to move forward in this cool new format. I'm sorry I may have a face for radio, but
we'll see you next month.
That's right. So, well, join us next month as we'll be talking about what'll be coming up with the budget.
Yep.
What'll be happening on a federal level in terms of how we're kicking off and what's happening with COVID. And join us for our special guest next month too. So again, thanks for joining us. We appreciate you taking the time, and we'll see you next month.
Bye, everybody.